Hello, everybody. Sam here, engineer, MBA, and investor. And in today's video on this gloomy Saturday, wherever you are, hopefully it's better than here in Toronto, we want to talk about this video here on the screen, this quick interview between the interviewer and who's named Brad, who's very known in the CRISPR landscape and genomics, biotech as a whole, but more specifically and more importantly with the patient, Jimmy, which we happened to have interviewed a couple of years ago. If you guys remember, it's still on my homepage here on YouTube. We interviewed Jimmy, who was basically a patient for what's now called Casgevy, and he has been cured officially. At the time, I still remember he couldn't use the word cure. He actually corrected me at the time during our interview. But he has been cured. And I want to talk about here in this video why this is such an important topic to talk about. But let's take a look at the video first. Let's play this interview. It's just 2 minutes, just short of 3 minutes. I'm going to speed it up here so that we can go through this video a little bit quicker.
Sickle cell disease, mine in particular, aside from the vaso-occlusive crisis, there's this lingering pain that I always had, and I was in a pain pump at the time. And 2 weeks after getting infused with my new cells, I noticed that pain had completely gone.
Yeah. And how long ago was that, and what has your life been like since then?
That was 5 years ago, and my life has been, like they say, transformative. It's a truly transformative therapy. It's a completely different person, able to do things that I've always wanted to do. Now that I have this foundation of the gene therapy to propel me, I'm able to go and achieve things that I've always wanted to do. It's been fantastic.
And do you have any lingering crises or feelings of sickle cell disease, or is it you got the gene therapy and you haven't felt anything or looked back?
So I got the gene therapy, unfortunately, quite late in life. That's why we're advocating for early infusion. The quicker you can get to children with sickle cell disease, the better chance they'll have to truly enjoy the effects of the therapy. So there are things that have happened to me already that gene therapy can fix, like the vascular necrosis we talked about. So I still have that. But aside from that, I don't feel anything. I haven't been in the hospital. I don't have any more crises. I was able to summit Kilimanjaro last year. It's just been fantastic.
And have you been advocating for others to do this? And what do you feel the awareness is? I always say, an amazing thing about the biotech sector is things that exist today, a lot of people would think are science fiction or don't even know about. Yeah. And this is a classic example of that. Do you feel that within the sickle cell community, there's broad knowledge that this is available?
No, there isn't, unfortunately. We like to call it Star Wars medicine. This is how advanced this is. And I often forget I live in a bubble. But the truth of the matter is patients that are in desperate need of this therapy, one, they don't know about it. There's not enough patient educational materials. And then worse than that, it's quite inaccessible right now. Payers are still trying to figure out how to pay for it. Even when your insurance approves the therapy, we have patients that have been waiting over a year just to not even get infused, to get collected. So there's so many issues that we still have to figure out. And not to talk about the issue, the main issue is that sickle cell disease predominantly affects people living in sub-Saharan Africa. And there's no way to get this, at least in this ex vivo format, to them. So it's so many issues that we still have to fix.
Alright, so there's a lot there. There was a lot there. So, couple of notes. First of all, Jimmy looks pretty good in that interview with the suit, with the little turtleneck, black turtleneck. I love that style. Actually, that's the style I've been rocking these days as well in certain events. So, massive respect on that style. Looking really good. But more importantly here, a couple of points Jimmy brought up, and I think we should talk about it. And we should make it a lot more visible. First of all, there's a lot of patients that are in dire need for a cure for sickle cell disease or even beta thalassemia here. Any sort of blood disorder is terrible. Jimmy talks about how he is cured from sickle cell disease. However, because he took it later in life, he still has a couple of issues, which is why he's, and many people, including myself, are advocating to get this cure out for people early in their life so that they don't get those side effects later on, permanent damages to their body. But besides that, like he said, he's cured, he's feeling good, he's looking good. Again, we interviewed him, I think 2 years ago at this point. he looks a lot better than 2 years ago, okay, guys? And he looked really great 2 years ago. He looks really great here. And I think that just speaks testament of CRISPR Therapeutics and Vertex continuous work to really get this cure out, approved, commercial available. Unfortunately, like he said, the whole insurance thing, the wait time thing, that's a challenge. Look, CRISPR was never going to solve the whole loop. Okay? CRISPR, the technology, was never going to eradicate bureaucracy, eradicate inefficiencies. It was never going to be a technology that's going to be out in the market and now we've solved every single problem with healthcare and diseases. No, it was never going to be that. It was a tool in a toolkit. And it's a powerful tool, it's a successful tool, and it is a very essential tool to the path of eliminating rare diseases. First step, then you move on to other sorts of diseases, including cancers. And of course, then you move on to major type of healthcare issues. Obviously, we're talking about, cardiovascular diseases and so on, which is a leading cause of death in North America, both in Canada and US. But before you get that, you do have to tackle the insurance problem, regulatory problems, healthcare problems, how to get this dosage in patient's body in certain regions where we people in this channel understand it's not going to happen anytime soon. I mean, he spoke about it in South, in certain regions of Africa, which basically has the largest amount of population with sickle cell disease, unfortunately. How do you get this cure to those people? Because again, this is all not editing the germline. So even though you're curing Jimmy, the patients such as Jimmy may have children that may inherit those traits that may have, unfortunately, them as well into sickle cell disease or beta thalassemia or any sort of these rare diseases, right? And we got to think this through, right? This is a bigger scope, and anybody that got in this space thinking that CRISPR Therapeutics, for example, was just gonna get this program approved with Vertex and everything was gonna roll. Now you have thousands of patients dose and cure on a monthly basis. That was never the storyline. That was never something that people in this space accepted, or rather people that have been in this space and kind of understands the different components of this loop. It's a full loop, right? There's a lot of things involved here. Again, CRISPR is the center. It's the core of all of it. Don't get that twisted. It is very essential, but there are things that you have to get aligned before getting it to the patient and ultimately getting patients cured, to have them productive in society, efficient in society, grow GDP in that sense. Again, having something in the market that's never been possible before, that's what CRISPR allows you to do, but it's not going to magically eliminate inefficiencies within the FDA, for example, bureaucracy, with not just with the FDA, but with different regulatory bodies. It was never going to do that. You need political support. You need people to speak out to their local representatives in their local government, whether that's municipal, state, or provincial wide, and of course federal wide as well. I mean, there's a lot of work involved here, and of course these companies are doing it. You can bet that CRISPR Therapeutics and Vertex are on a daily basis talking to politicians, government bodies. For sure they are. But it's up to us as citizens, as people in this space, in this community, to spread the word, get more people involved, educate people, set realistic expectations, right? I think this is what this space is missing, or has been missing for many years. It's very hard to set realistic expectation for something that's completely new, right? People always want to have something fast, quick. They always want to be part of that amazing story. Again, less input for most outputs for someone's life. I mean, we all want to put less into something and get the most out of it. But that's not how it works, right? New technology takes time, is groundbreaking, which is great, which is why a lot of people in this channel, have been supporting these videos and have followed these companies and have done their homework, have done the work, and are continuously doing work in this space. But there are a lot of things in this space that needs to be aligned that needs to be corrected rather for us to get to that dream, right? That dream where you can start deploying this on a massive scale, right? Again, CashJFI is going to do that this year. I strongly believe it. I think next year they're going to scale really quick as well, and it's going to compound over time. But for the other programs, not just for CRISPR Therapeutics and Vertex that they're working on, but for Beam Therapeutics, for Caribou, for NTLA, for Verve, for Prime, all these companies are all in the same space, right? They have all the same challenges. They may be some are earlier, some are maybe later in the mature stage of their clinical trials, but they're all gonna run into the same problems of insurance, of money, of regulatory problems, of regulatory challenges rather. So something to keep in mind. Again, beautiful interview here from Jimi. I'm very thrilled to see, you know, someone who we interviewed in this channel come up in this space and talk about the importance of getting this cure out early on for patients. But it just reveals, you know, how amazing CRISPR is, but there are other things we have to tackle. And again, we all have a role in this space. You know, I have a role, you have a role watching this channel. Everybody has a role, right? And I think it's about a matter of spreading the good word. It's about educating people, answering questions. There are no dumb questions. Not everybody knows everything. Look, I'm not an insurance expert. I don't even know how these things work on a state-wise. I'm not even American. So there's so much there to learn. And again, all we can hope is, you know, we continuously do the work. It takes time, but I think we eventually hit that dream, you know, having that CRISPR move humanity to a new level. I really think so. So I'm going to end this video like this, guys. As always, subscribe if you haven't liked this video. First video in 2 weeks, guys, so do like it. It really does help our channel. It really is helping our channel, actually. And comment below what you guys think. What do you guys think about this video? What do you guys think about Jimi saying those words? Let me know in the comments. I'll see you guys tomorrow on Sunday. Have a beautiful Saturday.